And at the end of the day, I'm worrying about the paperwork and the click boxing instead of the actual patient. I mean, people that are doing these meet and greets are those ones that are frustrated with the system, don't feel heard. They don't feel like they can get into their doctor. And my whole goal is being that family physician that's trained from being born till later on in life, knowing that patient and guiding them preventatively lifelong and being there
Mm-hmm.
for them. And from being from the area, my goal is to be here
Yep.
for a long term.
Yep. Welcome to DPC Life, the podcast where independent doctors share real stories, bold ideas, and the freedom of doing medicine on your own terms. I'm your host, Dr. Ann Gonzalez, and together we'll explore the wins, the struggles, and everything in between. Let's dive in. Today, my guest is Dr. Marissa Fusella. She is a family medicine doctor in Latham, New York, and is just opening her direct primary care practice. Welcome to the podcast.
Thank you, everybody. Hi, Anne.
Hello. Thank you for being here and thank you for sharing your story. So, let's talk about how you got into direct primary care, your why. What's your purpose in doing this?
So I've been working at my current job for about 8 years, and I love what I do. I love seeing my patients. I love getting to know them and their families. But I have realized that visits are becoming shorter with patients. People are waiting a long time to see me. And at the end of the day, I'm worrying about the paperwork and the click boxing instead of the actual patient. And I just don't feel like for the long run, that is good for my patients as well as myself and my family. And once I found DPC, I knew that this was the way to do things, to be a full rounded family physician, just the way I was trained, and bring me back to my old school roots.
Mm-hmm. Mm-hmm. So, you were in employed practice until just a couple weeks ago, correct?
Correct.
Yep. And as a family physician, were you doing full scope with OB and peds?
I didn't do any OB.
Mm-hmm.
I did see pediatrics. So
Mm-hmm.
I saw newborns all the way to older adults.
Cradle to grave.
You got it.
Yeah.
You got it.
Yeah. Mm-hmm. You have other DPCs in the area. How many other
Yep.
offices are there near you?
So there's maybe like a handful. There's one just started out in September. There's another one that's starting out soon, and there's been a few that have been around for the last couple of years. But
Mm-hmm.
everybody's very open and welcoming, and like I said, that's the best part of the CPC community.
Yep. With having other local DPCs, you have
Yep.
coverage. If you want to take a break, you have people who are nearby that can help you. Have you met everyone that's DPC in your area?
I am very familiar with a lot of them. I'm
Mm-hmm.
sure I'm learning new people constantly that have been out and I just didn't even know about. And I think that is the difference. Obviously, being out in a business world, you meet a lot of different people, a lot of services that could actually help your practice and be good referrals. When you're in the system, you're very focused on just those offices, just that immediate medical system. And it just is refreshing to meet
Mm-hmm.
other businesses and therapists, occupational therapists, various where people could benefit from.
Mm-hmm. Yeah. So your practice is officially open and you're opening in a couple of weeks?
Yep. So I'm currently in that transition. I've done some meet and greets. I have a list of people that want to enroll, and I have had a patient enroll already. So,
Yay!
yeah. So very
That
exciting.
is
Very exciting.
exciting.
Yeah.
How did those first meet and greets go?
They went well. I mean, people that are doing these meet and greets are those ones that are frustrated with the system, don't feel heard. They don't feel like they can get into their doctor.
Mm-hmm.
They just feel like they're being referred to all different specialists, and they realize direct primary care is the way that can help with this. And my whole goal is being that family physician that's trained from being born till later on in life, knowing that patient and guiding them preventatively lifelong and being there
Mm-hmm.
for them. And from being from the area, my goal is to be here
Yep.
for a long term.
Yeah.
So,
Yep.
yeah, so it's like very exciting. It makes me feel good at the end of the day that, there is this direction to go.
Right. Now, your previous practice, are you close enough that patients can follow you?
So I had a non-solicitation clause
Ah,
in my contract. So people can definitely find me on social media. And I think that's probably what they will do. But that's kind of how I left things with
mm-hmm.
them. But I do miss my former patients. Every day I wake up saying I was just used to that, going to the office, seeing my patients. And I really love it and I
Mm-hmm.
really miss it. So I can't wait to open these doors and start seeing new patients and meeting other people and hopefully education about DPC.
Yeah. So, how do you find your patients? What's been the best way to attract patients for you so far?
So I will let you know I'm very new on this whole social media. I'm not very good with technology. So this has been a learning. What I've done so far is I've used Facebook
Mm-hmm.
as a big one just to kind of start advertising my practice. I've also used the BNI group. I had friends from college that got me involved with BNI, and that has been eye opening. And I think it eye opening to the point where I didn't even know there was that like other side of business
Mm-hmm.
or other people to talk to. And they've been very good with helping me out, just referrals or how to do this marketing wise. Because
Mm-hmm.
when you're in medicine, you're just focused on going to see that patient. You don't really go into that whole marketing or social
Yeah.
media part.
Mm-hmm.
But in DPC, obviously, this is very new. So this you have to kind of be out there and educate. And I think that's the biggest thing. And so far, I think it is working, and I think it will take some time to come across. But I hope I'm doing it the right way, and I hope people will guide me along too.
Mm-hmm. Well, just putting yourself out there, number one, that is
Yeah.
the first thing because
Yep.
that is the hardest thing, right? To
Yes.
actually say, this is what I'm doing. Hello.
Right. Right. Yep. And for myself, that's just never been me. I take care of my patients. I have three little boys. I just focus on, them. And it's very hard for me to be like, me, me, me. This is what I'm doing. But
Mm-hmm.
I think it's for the better good now. And I'm realizing this is good. This is a different form of education that's different than people's health. It's how to get better healthcare, how to get better access to your doctor. And there's a different model that can do this for you.
Right, right. Now, not everyone is familiar with BNI, so can you tell us more about that? How does that
Yeah,
work?
so it's a business organization that's nationwide. In this area, there's many different chapters, and in these chapters, there's all these different business people that run their own businesses, and they talk to you about them, and they can get your input on how they could help you in your business and how you could help them. And the goal is to get referrals to your businesses and meet other people in different industries. And I think that in itself is just refreshing as a sole business owner,
Mm-hmm.
that you have a different kind of community that's outside of your actual industry, but also realize you all can help each other out. And in medicine, I see all different people, patients. They come in with all different jobs. And I think that's a huge part of their healthcare, knowing the actual jobs that they're undergoing. And this is a different way that you can do this. And I think for a DBC just starting out, it's a way to get your whole educational spiel about what DBC is. And I think for a lot of us, it's kind of hard, especially if you're not used to that public speaking component. It's a good place to start and practice because they're just there to guide you along in that. And it's local. So I think it's been a great start for me. I'm just in the starting stages of it, but it's been very great, good for me to start.
And the referral issue, so you can get referrals from the other people in your BNI group. So
Yep.
if they know friends or family that could benefit. But the other thing is they are also business owners and so they're employers and they can work with you.
Absolutely. Yep. And
Mm-hmm.
I've talked to people about that too. So, yes, that's a whole different side of the DPC that I'm just starting to learn, but that definitely has already come up.
Mm-hmm.
And for that cost saving aspect of their healthcare and their own employees, how this could help their business. So,
Mm-hmm.
the conversation has already started with a few people on that. So, yes, that has been very good.
Yeah. And then also the fact that HSAs are now okay, really officially approved to
Yes.
be able to use
Yep.
for memberships. So that's even more
Yep.
helpful. Yeah.
Absolutely.
And the interesting thing about BNI is these groups only allow one person from each industry. So you don't have five plumbers or five roofers in the same
Yep.
group. which makes it
Yep.
very, very helpful.
Absolutely. Yep. And that's what they said. They haven't had a doctor in a while there. So,
Mm-hmm.
so they were definitely really wanting that.
Mm-hmm. Yeah. Now, some BNIs can be expensive. I'm curious, how much is the BNI up there?
So that I don't know yet because I'm not
Oh, you're
yet
still
a
a guest.
member.
Okay.
I'm still a guest, and I just am learning this because there's so many different chapters and times, and some people are video or hybrid, and so I'm just still in the starting stages of being like, okay, is there one that's closer to me, or I want to see what if other ones have different avenues where it might be more beneficial with the healthcare system. But once I do decide I want to be in one, they'll kind of give me that membership
Mm-hmm.
information.
Mm-hmm.
But I guess you can go and visit twice per chapter
Oh, that's a
here.
lot of
So that,
visits.
yeah, it is a lot of visits. And that allows you, I think, to see if the other members are something that could be helpful to
Mm-hmm.
you and that you mesh with. But I think it's a great thing because, like I said, I think there's over 10 around this area that you could
Wow.
actually go to. Everyone, it looks like, is different. And you can actually look up on the BNI all the different names
Mm-hmm.
of people and the different industries that they're in. And I think that's pretty neat thing you could do.
Okay, so that you can kind of pre-screen and say, okay, these I know these people, like I think I would fit
Yep.
in this group. Oh, I didn't realize
Yep.
that. Well,
Yep.
that's
Yep.
cool. Yeah.
Yeah. It's really neat.
Yeah. And then with if you have 2 visits a year, like that's half a year. You could
Yep.
just coast,
But
surf
there
along.
you go. There you go. Yeah. No, I think my goal is to sign up very
Yeah.
soon.
Mm-hmm. Mm-hmm. Yep, that would be great.
I've learned with this whole marketing, there is just so many things that you can incorporate yourself with it. And I think sometimes that is the hardest thing where in this position, because you're trying to get your word out there, but there's so many different ways. And you also don't want to get overwhelmed with these things.
Mm-hmm.
So I've been invited to a women's business group in the area, which is great. I'm going to be doing a talk next month about with the health prevention month. And then I'm going to be starting going to dinners there. And then I have the business meetings, but you also want to make sure that you are focusing on starting your practice and making sure all the pieces of that are being taken.
Mm-hmm. Yep. It can get overwhelming
Yeah,
because there are so many ways, like you said, that you can spread the word. So you kind of have to focus on what's going to be the most useful for
right.
you.
Yep,
And that's one thing about DPC is learning how to protect your time because
correct.
I think DPC owners, because being entrepreneurs, like there's a lot of this kind of shiny object syndrome where
Sure.
you squirrel out and you're like,
Yep,
what can I try next? So
yep, yep,
sometimes you have to rein it
yep,
in.
yep, exactly. Yep,
Yeah. Now you are practicing and living in the same place where you grew up.
correct.
How is that going? What do your
Oh, I
family
love
think?
it.
Hmm.
Oh, they love it. So I guess I never really thought I was going to come back home in high school. I always envisioned I'd be going to California or some other place, but and then I went down south. I was away from my now husband at the time and did the long distance relationship. And that was very hard being in Virginia, being so far home from New York. And when I decided to come back north, we both went to Ellis residency in Schenectady and then got married, had 3 little boys soon after. And it's been so rewarding. I think it's very difficult being in the medical field, especially when, you're significant others in the medical field without any family support. We're very fortunate that we have our family around us and our kids, and they kind of had guided us to take good care of our patients, be there for our families, and just be a well-rounded family physician. That's why we can.
Mm-hmm. Mm-hmm. Yeah. So your husband is also a physician.
He is. Yep.
He is. What kind of physician?
He's a family physician.
Oh, okay. So is he going to join you?
So he's gonna stay with his job right now.
Hmm.
He's gonna make this jump. He's very supportive. He's the backbone of myself and our family. So he's definitely for it. He loves his patients. He loves what he does. So right now he's letting me make that leap.
Hmm. Hmm. Yeah. Well, it's a really nice situation when you do have someone who is super supportive and,
Right.
able to let you do this your way because
Yeah.
it's really hard, I'd say especially for women because we carry a lot of responsibility in the
Right.
home,
Yeah.
and not only caring for the family, caring for the kids, and then having an additional, having a practice on top. It's a lot.
Oh,
Yeah.
absolutely.
So again, it's that you have to be careful and make sure about the boundaries of time and trying to, I wouldn't say there's a balance really. I mean, it's kind of a flow, no
Yeah.
harmony.
Oh, absolutely. Yeah.
Mm-hmm.
Yeah. But I think the one thing he said is the other day, he's so excited to come home now because I have so many different things that are going on. My biggest, obviously, I'm still looking for patients, and I think that's always going to be an up and down thing, but it's different than the day to day going, seeing the patients, doing your tasks, doing your callbacks. It's more exciting. You're building this kind of dream,
Mm-hmm.
and I'm very thankful for that.
Yeah. Yeah. I think it is. It is very exciting.
Yeah.
I mean, employed practice, at least for a family physician, is different every single day, right? So at
Yeah.
least that part is the same. Everything is different,
Yeah.
except
Right.
as a practice owner, your days are more broken up in seeing patients, but then there's also
Right.
admin, there's the
Yep.
outreach. Yeah, so
Yep.
it's even there's just a lot more variety, which I guess that's
Yep.
why we went into family practice, right?
Yep. Yep. That's right. That's right. Yep.
So now that you're opening up and you are starting, are you doing everything yourself or do you have any help?
So I am.
Mm-hmm.
Yep. So I'm going to start out all by myself. I'm going to be acting like a secretary, a nurse. And I think the why I want to do that is just to see how everything is done. I don't know how long I can do this for or what I can actually maintain, but I think when you're starting a business, you really want to know how things are done. And then that way you can pass that on to somebody so we can make sure that I'm aware of everything that's going on. Because again, going back to the system, when you have so many different pieces and so many people kind of in the same pot, it gets very confusing. And I want to try and prevent that for my business. And
Mm-hmm.
I want to be in the know.
Yes. And that's essential. I mean,
Yeah,
ultimately, because you're the person who's responsible for everything, so you need to know
correct.
where everything is and how
Yep,
everything works. And eventually, yes, you
yep.
can hand that off, but yeah, you want to know how everything fits and how everything got started too.
Absolutely. Yep. I'm doing a lot of learning, but it's all
Yeah.
good. It feels good.
Hmm. Now, how long did you take planning your DPC? When did you start thinking about this?
So I've been looking into this for the last couple of years. It wasn't until in the past year to 6 months that we really pushed myself to make this jump. I went to the summit in New Orleans this
Mm-hmm.
past July, and it wasn't until that conference that I said, okay, it's go time.
Mm-hmm.
Let's start really getting everything together. And that's when we finally said, okay, why don't you make a goal of putting your notice in October, goal of trying to start up after the new year.
Mm-hmm.
So that's kind of the timeline, and for the most part, it has worked out, and it's a learning
Mm-hmm.
process.
It really is. Are you opting out of Medicare?
I am opted out of Medicare.
Okay, you already did. So this
I
last
did.
January
Yep.
cycle. Great.
Yep.
Yeah, so that opens things up for you.
Yeah. Yep.
And when you started planning this, how did you do that? Did you use the books? Were there certain resources online that you used?
Yeah. So I signed up for the Facebook groups just to kind of see what the community was
Mm-hmm.
saying. I did the hint camp
Mm-hmm.
just to kind of put me on the computer and with education with other people that are going through the same process. I read different blogs. I had the books. There's just so many different resources. And I think, like anything, until you're actually in starting up your practice, it's hard to apply those things sometimes. So now, in the past 2 weeks since I've been officially done, now I'm realizing, okay, now I have those resources, I can go back to them. And that's
Mm-hmm.
kind of what I'm doing at this point. I think it's coming together.
Yeah. What would you say was the best resource building the practice for you?
So there's been so many.
Or top three?
Top three. I know it's hard because there is so many. And in the meantime, I've also reached out to a bunch of DBCs in the area and kind of done phone conversations. And honestly, I've started that out last year
Mm-hmm.
intermittently to kind of, and I think that has been good because at least you pick up contacts with people that are in the area or within your state. and I've reached out to them and they've kind of guided me through just simple questions.
Mm-hmm.
Right now, honestly, probably the Facebook blogs have been really good because that puts you in contact right away with people that are going through the same thing. So you're not feeling so alone. Um, I've done the, DPC podcasts like yourselves and like the ones that are online. I think those are fast things to listen to, especially when you're working out. For myself, I mean, I have the books. I've read like a few chapters, but unfortunately with life, trying to balance working, kids, and starting a new business, it's been a little challenge, but I have them and I think they are very beneficial as well. And I probably will have some more time as I'm starting out to get back to those.
Mm-hmm. Yeah. Well, now that you are open, what kinds of things are you planning to do with all the time you have? I mean, because you're still getting
Yeah.
patients, so you have some time, downtime. What are you going
Yeah.
to do?
Yeah. Yeah. So I think there's a lot of different thoughts in my mind. I mean, my goal is obviously to try and balance my work life as well as my family because I have three little boys, 3, 5, and 9. So they're very busy. So I definitely want to be a part of their lives as well. And I think right now for them, it's very exciting that mom has a new job and they're trying to be part of this as much as they understand at this point. So I think a lot of this at this point will be going out in the community. I've been even simple things like people that did my signs, people that put my embroidery on my scrubs, meeting those small businesses, helping each other out and being part of things like the Chamber of Commerce. I've been going to events the last couple of months, educating through those and just trying to get the word out to educate people that there is a different healthcare system model that they could consider. So I think that's going to be the next couple of steps here. I've met so many different people along the way that were thinking about joining forces and doing educational podcasts in the area, meet and greets over at my office, my new office, where we can do wellness workshops. This is the thing about the DBC. You can kind of do exciting things. Walk with a doctor. I see people doing nutrition programs I'd love to do. Just have even like a yoga class at my office, those kind of things, just to incorporate the community and build a good community team approach for better care in the area.
Mm-hmm. Yeah. So
Yeah.
obviously you're very community minded, which is wonderful. I mean
Yeah.
that's a family position for you.
Yeah. Yeah. Yeah.
I
Yep.
I did see pictures of your office online. It looks
Yeah.
beautiful.
Oh, thank you. Thank you. Yeah, that's just the start. So I was so fortunate. They left a lot of their office equipment here. So that is from what it was on day one. And I'm going to be changing it a little bit as we go. But I just wanted to have some kind of pictures out there so they can see
Mm-hmm.
how it is, when it started, and they can follow this journey with me as I transition it.
Mm-hmm. So was your office a doctor's office previously?
So it was a former plastic surgery office.
Oh.
Yeah, and I guess they never really practiced in this suite. They had it, I guess, all redone and they never were here for long and then they moved. So and then they left other exam chairs and they had redone all the floors.
Oh my
They Yeah, the
gosh.
front desk. So yeah, yeah. So
Wow.
when this came up, I said, you know what? It's a beautiful office. It has a lot of opportunities. It's way too big right now.
Yeah.
So it's definitely to a point where I could definitely sublease to people that may be beneficial with referrals and everything. So
Mm-hmm.
that's something to look into. Starting a business, I didn't know if I was going to be looking for my own place to sublease from, but when this came up, I said, everything happens for a
Oh
reason.
yeah.
I think we have a lot of opportunities here. It's very close to my house. So I think hopefully it feels good every time I come in here.
Yeah.
It doesn't feel like a typical family physician. It's a very calming feel, very quiet. And I think that's how your medical office should be, you know, not a
Mm-hmm.
happy place. I want my place to be happy and calming.
Mm-hmm. Yeah. You don't want it to be chaotic and
Yeah.
frustrated, full of frustrated
No,
people.
no, 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 no.
Well, that sounds amazing. I mean, if they
Yeah.
left all their equipment, I can just if those chairs, I'm just thinking about the chairs. They must be like
Yep.
$5,000 each. It's a plastic surgery office, so
I'm I'm sure. Yes, they definitely have controls that I don't even know how to use yet. So we're going to be working with that.
wow.
But yeah,
That's incredible.
they are beautiful.
Mhm.
Yeah.
Mhm. Yeah, it sounds like a lovely place and it does. I mean,
Thank
if that's
you.
where you started, those pictures look great.
Yeah. Thank
Oh,
you.
yeah,
Thank you.
absolutely. So, as we come to a close, I want to ask you, since you're just starting out, have you thought about where you want to be, like in 5 years? Where do you envision yourself?
So I plan on being right here.
Hmm.
And that's the biggest thing, just from the area, having little kids, getting to know all my patients, my community. I'm planning on being here lifelong as people's family doctor, as people's friend. And that's my vision for in the future. And I have some great ideas, like I had previously stated, about doing community reach outs, wellness events, just to kind of get out with the community and spread awareness, preventative medicine, as well as just quality of life.
Hmm.
And I think that's a huge thing. My goal is to hopefully, if things would increase with patients and the word gets out, I would love to have other providers with me. That would be my goal, and just expand the practice.
Hmm.
My goal is never to have too many patients because I think that is part of the DPC. So I think as a provider, I definitely only want to see a couple hundred patients. And,
Hmm.
as the patients expand over a couple hundred, start maybe adding some providers.
I think it's really useful to think ahead. Like
Yeah,
where will you be in 5 years? Like how many patients are you going to
absolutely.
have? Are you going to have another
Yep.
office? What kind of services are you providing? Because then it helps with guiding you as far as the decisions that you make. So if you know your kids were going, they'll be how old at that point?
Yeah, I can't, it's hard for me even to think about that, but they're going to be in their teens. So they'll be in high school. So yeah, they'll be watching the practice grow, and maybe they'll be, you never know. They might be helping out the reception desk. So
Why not,
yeah,
right?
yeah,
Or they can shred
yeah.
papers. They
There
can
you
sweep
go.
floors. They can clean
There you
bathrooms.
go. Yep, there you go.
They
Yep,
can
put
earn a
put them to
little.
work.
Yeah, they can earn a
That's
little
right.
pocket money.
Yeah. Yep. Well, they're so cute. I mean, right now when I first showed them the office, you're like, "Mom, can we live here?" I said, "Well,
That's
it
so
was so cute."
sweet.
Yeah, and it was very sweet. Very
Oh,
sweet.
so cute. So cute. Well,
Yeah.
it's really neat to be able to grow up in a situation and watching your mom build something from nothing and
Yeah.
make it succeed, which it's going to.
Yep.
I mean, it's direct primary
Yeah.
care practice.
Yeah.
You've got the right mindset and the heart for it. You're community minded. You want to serve your community. So, yeah, I think your kids are going to have a great experience watching this grow. And it's such a great lesson for them,
Absolutely.
you know,
Yep.
about.
Yep. And that's a huge part of this. I want to show them that you can do anything. You might have a little bit of bumps in the road,
Hmm.
but you can make things what you want with practice. And I think another thing in this journey is as I transition, as a physician, I think most of us are you have to do things perfect.
Hmm.
And it's very hard for me to let things go. And I've realized even in the last couple of weeks, it's like, you better just post on social media, even if it's not perfect, just start going because that's the only way to get the word out there. And I think for me, it's been a little bit hard to do that, but I think that's the best thing to get out there and go.
Hmm. Yeah. It's interesting. I think, of course, being a lot of us are type A's and we're
Yeah.
perfectionists, right? I just
Yeah.
read something today. It said perfect is poison.
Yeah.
And that's a
Yep.
great saying because it really is
Yep.
true. Done is
Yep.
better than perfect.
Absolutely. Yep. And I think that's a huge thing for a lot of us starting out. It's just,
Hmm.
do your best, do it with your heart and keep on going
Yeah.
because if you wait for it to perfect, you're going to miss out on a lot of opportunities.
Yeah. That's a great place to end. I love that.
Yeah. Yeah.
I love that. So
Yeah.
I just wanted to highlight some things that you did say, especially that helped you is
Yeah.
reaching out to the DPCs around you and
Yeah.
getting
Yes.
support and
Yep.
then getting active on the Facebook groups, learning
Yep.
from the people who have already done it. And yeah, the Facebook groups are wonderful.
Yeah.
People are so sharing and
They
ready
are.
to share and talk about their experiences, even if they're not great,
Right. Right. Absolutely.
because
And I
everything's
think
not
just the
all roses.
struggles.
Mm-hmm.
Well, that's it. Like just hearing the struggles. I mean, even telling my experience right now, I only have one patient enrolled. Really focusing. hopefully check in with me in a couple months. Maybe things will improve. Hopefully they will. And how
They
did I
will.
do that? So
Yeah.
yeah, I know, and I'm sure they will. But, just for other people to realize it's a lot of times we just hear, oh, so and so has 100+ patients. Well, how long did it take them to get? So I just want to make sure that we're all feel like able to communicate and guide each other and help each other out.
Some people will say that they've got 100 patients when they opened,
Right.
and that's not everyone.
No, no, no.
That's
So
not
it
everyone.
no, and it takes some time, I think, in the transition, out from your prior job to kind of get your word out in the community that you've even left that current job and you're
Hmm.
doing something, different.
Yeah. Yeah. And your previous practice is not, they're not going to tell your patients,
Oh no, no,
unfortunately.
no.
Yeah, you definitely got to get the word out on your own. It's on
Yeah.
you.
I saw that you're doing that, I think in the Carolinas, you're getting people
Hmm.
together. I think that's
Yes.
great. I mean, I don't know if you've ever thought about doing like kind of like a bunch of people that are starting out and kind of being mentors, even online, just because I would love to go to something like that. But from New York,
Hmm.
it's a little
Yeah.
difficult. But I think what you're
Yeah.
doing is great.
Oh, thanks. I did. Yeah, I did actually think about like virtual, but one of the things, and you went to the summit, so one of the things
Yes.
that's really, really good about the summit is the in person,
Oh, yeah.
just meeting people. And I think online is wonderful. I mean, obviously we went through it in COVID and, everyone did Zoom
Yeah.
stuff and so there is benefit to it. It's just
Yeah.
not the same. And
Yeah.
I was trying to think of how can you do that? And it would be kind of like, you'd have like a big Zoom room and
Yeah.
then do breakout sessions, but even still, like it's hard. It's hard to
Oh,
do
yeah.
just online
Yeah.
breakout sessions. I've
That
done
is
them
that.
before and it's a little awkward
That
sometimes.
that is true. And I don't know how
But
big your network is, but even, if you did something like that and then brought people to these events together, so you're kind of like in all these different states doing DPC, and then you kind of came
mhm.
into
Mhm.
a small
Mhm.
group where you met each other. So many
There's all
good
kinds of
good
ways to do
ideas.
it,
Yeah.
right? I
Yeah. No,
know.
but
I
I
was
think
like,
you're
oh,
doing great.
maybe doing like I get to go to different places
There you go. Yeah, that
and
too.
have things, organize things in different places. So
Well,
yeah,
and
there's all
then
kinds of ways to do
that's
it.
a great thing to do too. You could do something like that and go to people's different offices all around the
Mhm.
states, and everyone could
Mhm.
show off what they do, what their DPC is like. So there's so many different things you can do. That's
Mhm.
wonderful though. I love this what you're doing, and I think
Oh,
it's great when
thanks.
especially when you're starting out and you kind of feel you're a little alone doing this kind of new thing,
Mhm.
and but I think it's great.
That's one thing about DPC is it can be very isolating,
Yeah.
period.
Yeah.
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 And I think, especially if you're in a place where there's no one there. And I think there really is like you're in the DPC women group, aren't you?
That I don't know.
No.
I don't know if I am actually. I didn't know there was a
Yeah.
separate one, but I'll have to look at that one then
Mhm.
too. There's so many different groups.
There are.
But yeah,
There
no, I'll
are.
definitely look into that. That would be wonderful.
Yeah. I'll look and see and then I'll invite you if you're not. But I
Yeah, please
really
do.
I really do like that one
Okay.
because I really think I mean DPC is DPC, but there are differences between, just like we were saying, a woman doctor starting a DPC practice
Sure.
versus a male doctor.
Sure.
And I mean, it is what it is. I'm not
Yeah.
disparaging anyone. That's what it
Yeah.
is.
Yeah. Yep. Well, it's just sometimes whoever's balancing that house. My husband was joking with me with this morning. He's like, focus on getting patients. Don't focus on the home, doing the dishes, doing the laundry. But unfortunately, as part of what I've always done, I have to run the whole household too. So there's certain things. And I think it's good for me mentally to take that break, take care of our house, to make sure our kids
Mm-hmm.
are properly going. But sometimes that mindset you have to kind of
Mm-hmm.
realize.
I love that he's saying that because what an enlightened husband.
Yeah. Oh, I know. Yes. He wants me just to focus on getting the business up and
Yeah.
running
Yeah.
and supporting me through this kind of going from an income to no income. And that in
Mm-hmm.
itself is sometimes a little tricky.
Mm-hmm. Yeah. Well, are you familiar with Dr. Una?
It sounds really familiar.
So she is a business coach for physicians. She
Yep,
has
I
a
know.
business school. Yeah,
Yep.
Entree MD, business school. And she always talks about having a home team.
Okay.
And other business coaches talk about this. Alex Hormozy's one, talking about the value of your time,
Sure.
right? And some people love doing dishes. I mean, great. You love
Yeah.
it? Fantastic. Do it. I hate it. I hate cooking
Me
now.
too.
I'm like, I've cooked for 25 years for I am done. I don't
Yep.
want to anymore.
Yep. I don't like it either, but I know if it doesn't get done, it's going to be there tomorrow.
Right.
So it just builds up,
Yeah,
especially with three little
exactly.
kids.
Right. Yeah. But that was one thing she said, really trying to get a home team,
Yeah.
and because that's still part of your business per se,
Sure.
you know?
Yep.
So yeah, your husband's got that mentality too, it sounds
Yep.
like.
Hmm.
So that's great. Having someone supporting you is so important.
Absolutely.
So
Said that you do some coaching.
so what I'd done was coaching calls for people who are new, working on their elevator pitches, and I was trying to pull out some of what you've done already. So the BNI,
Yeah.
which is wonderful,
Mhm.
talking about what have you done, what's worked, what's not worked, trying to help people think about other options. Although you're doing fantastic, you're
Thank you.
already doing a lot of the things that some people just hadn't thought
Yeah.
about. But you're
Yeah.
thinking about your referral sources.
Yep.
You're thinking about using the BNI to hone your elevator pitch. Yeah.
Yeah.
So, and that's the
Yeah.
thing, is a lot of people just don't have that down. And the only
Yeah.
thing I would say probably is, and this is a problem for family physicians in general,
Hmm.
when you go into DPC, is you went into family medicine because you like the variety, you like the relationships. They become like your family and friends,
Right.
right?
Yeah. Yep.
But when you send that message out, you are basically speaking to everybody, and it dilutes your message.
Okay.
Because
Yeah.
when you talk to people, like if you're on social media and you want to talk to people, you want to have a message that will directly address your ideal patient, so
Right.
that when they
Hmm.
hear it, they're like, oh my gosh, she's talking about me.
Yeah. Yeah.
That's me. And then that way, that gets their attention. So if you're just like, I
Right.
can see anyone from the cradle to grave, which is true. I mean, you can,
Yeah.
right?
I can.
But then no one really feels like you're talking directly to
To them.
them.
Yep.
So that's probably what I would say is in your messaging, is trying to pick like your ideal
Yeah.
patient. Not that you would only see that person,
Right.
because most people, like I said, they don't want to narrow it down, although there is some value to that. But you want to send out your message to somebody in particular. And honestly, if it is like women, moms, 30s,
Yeah.
40s, the decision makers for healthcare in their family anyway.
Right.
So when
Yep.
you reach them, you're going to get the whole family. You know what I
Yeah.
mean?
Yeah. Yep.
So that's kind of who, if that's your focus, which most of the people I talk to, because we're women in the same kind of
Yep.
age range,
Hmm.
similar situations, moms, we like to treat patients that are like us.
Yeah.
So
Yep.
if you start calling them out specifically,
Yep.
then, all the rest will come too.
That's true. Yeah, that's a good point. Yeah, I think for me, it's been very hard to get that avatar patient because as a family physician, you see everyone, like you're saying. And I think from this is just those people that are really just frustrated with the system, not feeling heard, not being able to see their doctor, and that busy professional that needs to get in and they want their physician actually to know them
Mm-hmm.
and have that trust with their physician again.
Yeah.
Um, and just promote preventative care and quality of life.
Yep. Yeah. So if you think about who your favorite patient is, like right now,
Yeah. Yeah.
or your favorite couple of patients,
Yeah.
that's probably your ideal patient. And
That's a great thing to
yeah, and you
think
can
about. Yeah.
think who is it? I could
Hmm.
totally pick them. Like they're probably somebody you're like, oh, I could totally hang out with them. We can
Yeah.
go grab a cup
Yeah.
of coffee, and it would be nice to
Yep.
see them. So that's
I love
yeah,
that. I
yeah.
love that. I think I've never heard somebody say that to me because, like I said, it has been such a hard thing. So I really love seeing all patients
Mm-hmm.
at different struggles in their life. But I think that that's a great thing to do.
Yeah, and it really, again, it just comes back down to you like to see people who are kind of like you,
Yeah.
and then that way, if you can find whoever that person is and narrow it down and think about, why do you like them? What is it that draws you to, why do you
Yep.
like seeing them? Is it because of their personality, or is it because of things that they do or that they care about? And then trying to find other people like them. So if it's like their moms, they've got 3 boys like
Sure.
you,
Yep. Yep.
then, okay, how do I find more of these people? Like
Right.
you can ask if you have a couple patients that you end up enrolling that are your favorites.
Yeah.
And then you can ask them just like, what do you do? Where do you hang out? Where can I find more
Right.
people like you?
Yeah.
You know?
Yep. That's absolutely it. Yeah. And go there.
Yeah. So then,
Awesome.
yeah, you just got to go to the places where your kind of people are hanging out, because if they like you, then their friends are probably going to like you too and
Right.
want to go to your practice as well. So that's
Yeah.
one thing. So you think about who your favorite people are
Yeah.
in your
Oh, that's great.
previous
I
practice.
love that. I love that.
Yeah.
It makes me excited to do what I'm doing.
Yeah, you're excited to go to work.
Yeah.
Mondays aren't
Yeah.
terrible.
Yeah. No.
Coming back from vacation, you won't believe it. It's so nice.
Yeah. Oh, I'm sure.
It's-
I'm sure. Yep.
Instead
Yep.
of a full inbox, it's
Well,
like
that's
5
it.
things.
No. Nope. And you
It's so
know what's
nice.
going on. So yeah, it's just
Yeah.
I can feel it's just a better way to do things.
Yeah, definitely. Well, tell us how we can find you, Dr. Fusella.
So you can find me on FusellaFamilyMedicine.com. The way that can look at my website, find out exactly what I'm doing, and set up meet and greets. A meet and greet, then that's when we talk about how to enroll from there. Also on the Facebook group, my business through Fusella Family Medicine, also on Instagram.
Mm-hmm. Perfect. So we'll have all of those links in the show notes. And hopefully you are going to just take off. Your practice is going to grow very quickly. And I'd love to check in with you maybe in 6 months or a year and see where you are.
I would love that.
Well, be safe. And
Yeah,
best
thank
of
you
luck.
so much. Thank you so
Keep
much. It was
going.
so nice
You're doing
talking to
great.
you. Thank
You
you. Have a good
too.
weekend. Take
All right.
care.
You
Bye.
too. Bye. Thank you for listening to DPC Life. If today's conversation inspired you, hit follow, leave a review, and share it with a friend who's ready for change. Remember, wherever you are in the journey, your DPC family has your back. Until next time, keep building a practice and a life that truly fits you.